So the first panelist is Dr. Alan Gill, who I've known for several years, and he's a primary care physician with Multicare, or excuse me, Tacoma Family Medicine with Multicare. He teaches in a family residency program, and he also has a 23-year-old son, Matt, who has autism. He's also on the board of the Pierce County Coalition for Developmental Disabilities. So please welcome Dr. Alan Gill.
Like I said, I'm a family physician here in Tacoma. I've been here since 2000. My group, Tacoma Family Medicine, and I are, I'm sure, the largest providers of primary care services for adults with developmental disabilities in general in the county. Probably have 100 and some personal patients with some form of developmental disability. A lot of them have autism, although not all. Can you hear me in the back there? I'm seeing signals. No.
Sorry, that's just what I do.
Okay. I'm involved as a primary care physician with a lot of folks, and also personally, and I'm pretty far down the autism trail and do a fair bit of advocacy stuff as well. So I have a little bit different bent than perhaps some primary care physicians. Some will be very attuned, some will be not so attuned to your issues. So finding a good primary care person is sometimes a little bit of work. So I want to talk about both primary care in general and what you can expect of your primary care physician, and maybe how to find a little bit about how to find a good one. So this is sort of a long-winded definition from the 90s of primary care. Primary care has been around long time. The old general practice physician was a primary care physician, and it's evolved somewhat over time. But the bottom line with primary care, and it's in this definition, is that we take care of most of any given person's medical problems. The idea is to have a sustained relationship with your physician, so they kind of know you and you know them, which works much better than starting all over again every time you see somebody. And then the third thing is, hopefully we also know a little bit about your community and your family so that we can assist you in that context. Again, everything works better if we know a little bit more about you. So primary care is kind of a little more holistic, wraparound, whole person services ideally. You may hear medical home. It's being touted a lot in the press now. It's a new old term. Medical home's actually been around for a long time. And essentially, it's very similar to primary care. You could talk more about it, but if you have a good primary care physician, hopefully they're providing you with a medical home. There are a bunch of different docs who provide primary care. Obviously, on the kids side are the pediatricians who do pediatric care, and they last till you're 18. You might be able to drag it out a little bit longer. I see lots of kids who transition in their early 20s, adults at that point. They generally have pretty good training around developmental disabilities. Obviously, it's variable, but they generally have good training around developmental disabilities. The second group is my group, family physicians, and we do birth to old age. So we take care of all ages. We don't go away when you turn 18. I would say it's probably more variable how much expertise people have with developmental disabilities and autism, although we certainly all take care of kids and are pretty well versed in normal development. So a little bit more variable. I think our strength is we take care of whole families, and we don't go away. We'll transition with you. And then the third group is internal medicine. Major group is internal medicine. Of course, they take care of adults. And get myself in trouble with generalizations here, but in general, I would say they're very good at complex medical problems and adult problems. Probably less training in general with developmental disabilities and autism, I would say, is probably true. So those are the kinds of docs in general that do primary care. So again, primary care, most medical needs, we're going to take care of them. We do prevention, so well child, well adult care, immunizations, all the preventive stuff comes really through your primary care doc. We also do acute illnesses, so the cold, the flu, urinary infections, minor injuries, skin troubles, I mean, any kind of day-to-day medical problem, we should be able to take care of whether you have autism or not. So all your day-to-day care comes through your primary care doc. Then we also are good with common behavioral and developmental issues, so we take care of the basic stuff. Things can get so complicated that we need help, but we'll help you with all those things. And then last, we do management of chronic conditions. So if you have asthma or GI problems or whatever, we can do the basic management and refer you. So it depends on whose numbers you believe, but 80 or 90% of your medical problems, you ought to be able to go to your primary care doc for them. The next thing that we do is care coordination. So you start with autism, obviously there's often other issues that you need assistance with, and then you start seeing people, lots of people sometimes. So we provide referrals to specialists, and some insurances, of course, require that. You must get a referral. That varies depending on the insurer, obviously. But we can provide referrals. We can help you pick somebody. We can give them information to help them get started. We also then get the information back, and we have sort of an oversight role. So suddenly you have 5 physicians all prescribing something, and maybe not being really attentive or even knowing what all else is going on. So certainly a big part of our job when things get complicated is to keep an eye on all that and try and make sure that it works in a good way, and that everybody kind of knows what's going on. And then last, you know, we have supply needs and prescriptions and medical equipment depending on what other issues a person may have, and we help you get those things from your insurance. So a lot of that goes through primary care. Then there's other things in care. There's obviously the mental health system, the school system, the social services. It gets very complicated. It gets very complicated for us too. It will vary somewhat from physician to physician how helpful they are with this stuff, but particularly on the pediatric side, most docs do work with the schools. We'll do your sports physical, we'll help with your forms for medications at school, and then to a greater or lesser extent, may be helpful with IEPs and that sort of advocacy, 504 plans, and ADHD is a big one that we do a lot of in primary care, although we get help from the developmental pediatricians as well, but we do quite a bit of that sort of thing. So care coordination is big, and your primary care doc, that's your person. One thing that you should kind of know about primary care, unfortunately, the way we work is we see people and we see them a little too fast. That is the nature of the way, it's the reimbursement system, frankly. And people tend to have 15 or 20-minute visits. That's not very long when things are complicated. So there's always kind of time pressure when you come see a primary care doc. So you need the nurse will get a brief history, you'll see the doc. It works really well if you come prepared. That helps us a lot. So if you know what you're looking for, you have your questions up front, you got your forms, they're ready, your part is complete, and you tell us what you need up front, it's going to go better. It's much harder because of the way the schedules are. We don't have hour slots. We got 15 or 20 minutes. If you suddenly roll out all the forms at minute number 19 of the appointment, suddenly you leave with not quite what you wanted. So being prepared is very helpful for us, and things go better. Bring your notes, bring your questions. If you got to cancel, please call us and tell us, because it doesn't help us if you're not there, because then we suddenly have a hole in our schedule. And really cultivate a relationship. I mean, I think primary care is all about that relationship. If you know your doc well and your doc's nurse and the scheduler, it's all better. Then you can ask for little favors, you'll get them. So cultivating a relationship is important. Yes?
In terms of coming prepared, is some of that coming prepared, is it possible to send an email ahead of time with maybe questions, concerns, that kind of thing, or is it?
It will depend a little bit on your system. I mean, when in multicare we do have a MyChart function. It gets complicated with adult age people with autism. More complicated because of guardianship and all those sorts of things. Children, parents can have that, and you can send things ahead, yes. So yes, that can be helpful.
And sorry to interrupt, but we're
Yeah.
going to try to save questions to the end, just in terms of time, just so the audience knows we want your questions, but we want to do it kind of all at the end with all the presenters. Thank you.
I would also comment on autism-specific knowledge. When Matt was diagnosed, people were really not knowledgeable at all, by and large. That's changed a lot in 20 years. It's still variable, but it's a lot better, and there are good national guidelines and a lot more knowledge out there. So one would hope that your primary care person would have some knowledge. If they really have none, well, maybe that's not a good fit. But it's going to vary, and I think you have to recognize that. Friends and support groups can provide some references. There's a lot of word of mouth. Recognize that we as primary care in the state of Washington cannot diagnose autism. We can refer you to get diagnosed, but we cannot diagnose, nor can we prescribe applied behavior analysis, intensive behavioral interventions. We cannot prescribe those. So those are some things that are beyond us. Alternative medicine, again, physicians are going to be variable. Some are more attuned, some are less attuned, some are more knowledgeable. In general, we tend to be sort of evidence-based. What's the science? Does this really work? I would certainly say it's better not to hide your alternative treatments. It's better for us to know what you're doing. And I think there's a good interchange there. I mean, there's more evidence than there once was. As parents, you get offered everything under the sun in terms of things that you might do for a person with autism. And it's overwhelming. I think the interchange can be useful in sort of prioritizing what's most helpful when there's more things than you could possibly do. So I think you can have good discussions about alternative therapies with your primary care person. And then I guess last, I think, you're the expert, parents are the expert on their kid. I mean, there's just no question about it. You know your child better than anybody else does. And you should expect to be a partner with your doc, and that's part of the relationship thing. But you're the expert on your child. Hopefully we're the expert on the medicine and the treatments. But I think if you can find a doc that you can work with, that's great. And I think, when we chose our primary care doc 20 years ago now here in Tacoma, well, not quite that long, 15, the primary care person asked my wife, well, what do you want from me? And she said, well, I want you to be available to see Matt on a day-to-day basis and to help me with all the things that I need, and I'll bring you information. And if you can do that, they were plain that they were not an autism expert, but they said, yeah, I can do that. I'll work with you. That's all we needed. You have to decide exactly what you think you need, but be upfront and you can negotiate that. So share your knowledge, share your worries, ask for little accommodations like I want the first appointment so my kid doesn't have to wait. You can work well with your primary care.